Composite bonding is generally considered a cosmetic treatment, and therefore the NHS will not cover it. Composite bonding is a really cost-effective way to make either small or major changes to your smile and appearance. This is because composite bonding tends to cost a lot less than some traditional cosmetic treatments such as porcelain veneers. Composite bonding in the UK tends to cost between £200 and £500 per tooth, depending on how much work is involved in each individual tooth. This cost should include any preparation of the teeth, which can involve removal of old composite or any old fillings, and any aftercare, including polishing and touching up. Generally, the lowest cost per tooth for composite bonding is around £200. This is for very minor adjustments, things like chips or very small gaps between teeth, and ranges up to around £450 or £500. This is for more extensive cases, such as where a tooth is very worn, very heavily damaged, or very badly fractured. Typically, composite bonding will last around 5 to 7 years, but this varies a lot and depends on how well it's been done in the first place, and more importantly, how well it's looked after. Sometimes it can last much longer than 5 to 7 years, but may require some touching up or polishing during this period. Considering the changes the composite bonding can make to a smile or to a tooth, and its relatively low cost compared to other procedures, most people would agree that it is a very cost-effective means of changing the appearance of the teeth, and something that's definitely worthwhile. Composite bonding is generally considered a cosmetic treatment, and therefore the NHS will not cover it. The only exception to this tends to be if a tooth is broken as a result of trauma, then it is usually possible to have it repaired on the NHS. However, it's worth bearing in mind that often the materials and techniques that NHS dentists will use will not be as advanced or as extensive as some of the multi-layered composites and techniques that we use to really perfectly mimic natural teeth. The cost per tooth will differ quite significantly, because for more simple cases like a small chip or a minor repair to a tooth, there is relatively little work involved for the dentist, and it can be done in sometimes as little as 20 minutes. Whereas for more extensive adjustments to the teeth, often there's a lot of pre-planning involved, and the procedure itself can take as much as an hour or more per tooth, and there's usually more aftercare involved as well, with reviews and polishing, adjusting the bite, and adjusting the overall finish of the teeth. At the Modern Dentist, we offer interest-free payment plans for treatments costing over £1,000 in total. For more information about this, give us a call or have a look at our website for details. If you're considering making cosmetic improvements to your smile, composite bonding can be a really cost-effective way to go about this. Sometimes composite bonding can be viewed as a stepping stone to a more definitive, stronger, longer-term solution, such as porcelain veneers. You can use the composite bonding as a template to work out the changes that you actually want to make to the smile. Make sure that you're happy with these over a few years, and then come back at a later point and replace these with something like porcelain veneers.